Emergency medicine is a critical field in healthcare. It is the front line of medical care, where every second counts and decisions can mean the difference between life and death. It focuses on the immediate care of patients facing life-threatening conditions. This includes a wide range of scenarios, from sudden cardiac arrests to severe trauma cases. From heart attacks and strokes to severe injuries and allergic reactions, emergencies can happen anytime and anywhere. The unpredictability of these situations requires a rapid and efficient response from medical professionals. Understanding basic emergency procedures can be the difference between life and death. Knowing how to perform CPR or how to use an automated external defibrillator (AED) can save lives before professional help arrives. This essay will delve into the world of emergency medicine, focusing on essential life-saving procedures. We will cover the basics of first aid, the importance of quick response, and the role of emergency medical services, EMS. We will explore various emergency situations and discuss how prompt action can significantly impact patient outcomes. From the initial assessment to the stabilization of the patient, every step is crucial. By the end of this essay, readers will have a better understanding of how emergency medicine works and the importance of being prepared. We will also highlight the importance of continuous training and education in this field. Imagine yourself in a situation where someone suddenly collapses, gasping for air. The immediate actions taken by those nearby can be critical in determining the outcome. Would you know what to do? Knowing the steps to take in such a scenario can make a significant difference. Calling emergency services, starting CPR, and using an AED are all vital actions. Or picture a car accident scene where someone is bleeding profusely. Quick thinking and immediate action can help control the bleeding and stabilize the patient until professional help arrives. These scenarios highlight the crucial role of emergency medical knowledge. The ability to act swiftly and effectively can save lives and reduce the severity of injuries. Knowing how to respond effectively in such situations can be empowering and potentially life-saving. It is not just about having the knowledge, but also the confidence to act when it matters most. This essay will guide you through some of the most common and critical emergency procedures, equipping you with the knowledge and confidence to act when it matters most. We will also discuss the importance of community awareness and preparedness in handling emergencies. One of the most fundamental aspects of emergency medicine is airway management. This critical skill is often the first step in saving a life during a medical crisis. A patient's airway is their lifeline, allowing them to breathe and receive oxygen. Without a clear airway, the body cannot get the oxygen it needs to function, leading to severe consequences. In emergencies, the airway can become obstructed due to various reasons, such as choking, allergic reactions, or trauma. Each of these situations requires a swift and appropriate response to prevent further complications. Airway management techniques aim to clear any obstructions and ensure the patient can breathe properly. These techniques are essential in stabilizing the patient and preventing further deterioration of their condition. Techniques like the head tilt chin lift maneuver help open the airway by repositioning the head and jaw. This simple yet effective method is often the first step in airway management. In some cases, more advanced interventions like intubation may be necessary. Intubation is a critical procedure that can make the difference between life and death in severe cases. Intubation involves inserting a tube into the trachea, or windpipe, to establish a secure airway. This procedure ensures that the airway remains open and that the patient can receive the necessary oxygen. This procedure requires specialized training and equipment. Medical professionals undergo extensive training to perform intubation safely and effectively. Emergency medical professionals are trained to assess the airway, determine the most appropriate technique, and perform the procedure quickly and safely. Their ability to make rapid decisions is crucial in high-stress situations. The ability to manage a patient's airway effectively is paramount in emergency medicine. It is a skill that can save lives and prevent long-term damage. It ensures that the patient receives adequate oxygen, preventing brain damage and other complications. Oxygen is vital for the brain and other organs to function properly. By understanding the basics of airway management, individuals can be better prepared to assist in an emergency until professional help arrives. Basic knowledge of these techniques can empower people to act confidently and effectively in critical moments. Community training programs and first aid courses are excellent ways to learn these essential skills. Being prepared can make a significant difference in the outcome of an emergency situation. Remember, in an emergency, every second counts. The swift and knowledgeable actions of first responders and trained individuals can save lives and improve recovery outcomes. Trauma, such as that caused by falls, car accidents, or violence, can lead to a wide range of injuries, each requiring specific attention. These injuries can vary in severity from minor cuts and bruises to life-threatening internal bleeding and fractures, demanding immediate care. Emergency medical responders are trained to assess trauma patients quickly, identify life-threatening injuries, and provide immediate stabilization on the spot. This often involves controlling bleeding, immobilizing fractures, and managing pain effectively. Controlling bleeding is crucial in trauma care, as excessive blood loss can lead to shock and death if not managed promptly. Direct pressure is often the first line of defense, followed by wound packing and pressure dressings to control bleeding. In severe cases, tourniquets may be necessary to control bleeding from limbs and prevent further blood loss. Immobilizing fractures helps prevent further injury and significantly reduces pain. Emergency responders use splints, slings, and other devices to immobilize injured limbs until the patient can receive definitive care at a hospital. By stabilizing the patient at the scene, emergency medical professionals can significantly improve their chances of survival and minimize long-term complications. Cardiac arrest occurs when the heart suddenly stops beating. This sudden cessation of heart function can happen without any warning, leaving the patient unconscious and unresponsive. This is a life-threatening emergency that requires immediate intervention. Every second counts, as the chances of survival decrease significantly with each passing minute. Without a functioning heart, the body is starved of oxygen, leading to brain damage and death within minutes. The lack of oxygenated blood flow can cause irreversible damage to vital organs, making swift action crucial. Emergency medical professionals are trained to recognize cardiac arrest and initiate cardiopulmonary resuscitation, or CPR, immediately. Their quick response can mean the difference between life and death. CPR is a life-saving technique that involves chest compressions and rescue breaths, which help circulate oxygenated blood to the brain and other vital organs. The rhythmic compressions mimic the heart's pumping action, while rescue breaths provide essential oxygen. In addition to CPR, defibrillation is often necessary to restart the heart. This process involves delivering a controlled electric shock to the heart. Defibrillators deliver an electric shock to the heart, which can restore a normal rhythm. This shock can correct irregular heartbeats and allow the heart to resume its normal function. Automated external defibrillators, or AEDs, are portable devices available in many public places, making it possible for bystanders to provide early defibrillation before emergency medical services arrive. These devices are designed to be user-friendly, with clear instructions to guide even untrained individuals. The first few minutes after a cardiac arrest are critical. Immediate action can double or even triple the chances of survival. Understanding CPR and how to use an AED can empower individuals to act quickly and potentially save a life. Training programs are widely available and can provide the knowledge and confidence needed to respond effectively. By learning these skills, you can be prepared to respond effectively in case of a cardiac emergency. Whether at home, at work, or in public, being equipped with CPR and AED knowledge can make you a vital link in the chain of survival.